What cytotoxic regimen do I use for the first-line treatment of metastatic gastric and G-junction cancer? Generally, the go-to regimen is a doublet chemotherapy with fluoropyrimidine and platinum, and preferred platinum is oxaliplatin. So FOLFOX chemotherapy is the general go-to first-line chemotherapy for our patients.
As a first-line regimen in the treatment of gastric cancer, we usually use doublets consisting of oxaliplatin and fluoropyrimidine, either capecitabine or 5-FU or S1. We also sometimes use cisplatin, but in most patients we prefer tablets of oxaliplatin and fluoropyrimidine like Celox or FOLFOX. In some patients, however, we also use triplets, most often FLOT, which is 5-FU, leucovorin, oxaliplatin, and docetaxel. I would say that we do use triplets only in young, fit patients requiring an intensive treatment. So approximately 20% of our patients would receive a triplet, but the majority of the patients are treated with a doublet.
We, in Japan and many of Asian countries, commonly use fluoropyrimidine plus platinum doublet therapy as a standard of care in first-line treatment for advanced gastric cancer. On the other hand, in addition to doublet, triplet regimen such as FLOT or DCF is sometimes or often considered as a standard of care in first-line treatment in Western countries. Furthermore, we, Asian GI oncologists, including Japanese oncologists, prefer to oral fluoropyrimidine agents such as S1 or capecitabine. So, SOX, CAPOX, S1 or capecitabine plus cisplatin regimens are widely used. Of course, FOLFOX is also frequently administered in case of poor oral intake cases, peritoneal disseminated patients, which is very usual in advanced gastric cancer, and so on. Why are there such different perceptions in Asia and the West? In Asia, especially in Japan, it is common for gastric cancer to be treated sequentially, first, second, third, fourth line, and so on. However, in Europe and United States, they often end up on the second line at best.
In terms of molecular testing, we test all patients in first-line setting for HER2 overexpression. So HER2 is the most established biomarker in gastric cancer. So every patient will be tested for HER2. In fact, in terms of other biomarkers like MSI or PDL score, these biomarkers are tested later on in the course of the treatment. In most cases, in the after or prior to second line or prior to third line therapy. We also do NGS, but not prior to the first line therapy. So currently, NGS is done later in the course of the treatment.